Hi, how are you? I'm Don Clavin, Town of Hempstead Supervisor. I'm joined by Dr. Dave Neubert, Head of Emergency Services here in the town, and Councilman Anthony D'Esposito. Right now we're going through a health crisis, and if we all remain calm and follow the advice we're giving, we will all get through this together. Simple things as washing our hands, covering our mouth when we cough, social distancing, and most importantly, remaining at home instead of going out. These are really important advice we're being told, and we need to follow it. When we all listen, we can flatten this curve, we can turn this around, and we can all get better together. But again, the opportunity here tonight is to answer and ask some questions from a leading medical provider right here. But the key thing again, folks, we need to remain calm, but we need to listen. We need to do things like not touch our face, and that's difficult for a lot of us. And we need to make sure we social distance. These are the things that we're being told, and they need to be followed. So again, I'm joined here tonight by my colleague, and that's first Councilman Anthony D'Esposito.
Well, thank you, Supervisor and Dr. Dave. And I don't think that we could reiterate enough that this is serious. And we've seen in the news over the last few days that it's becoming more serious. And I think, as Don mentioned, we really need to do our best to follow the protocol, follow directions, stay to ourselves, keep that 6-foot containment, and really do our best to keep everyone healthy. And Dr. Dave, I just want to thank you. I know I speak for my colleagues on the town board and for so many of us here that we are thankful for your guidance and your leadership during this coronavirus. So thank you very, very much.
You're welcome, Councilman.
So, you know, the Councilman couldn't say enough. Doctor, you've done a great job helping residents who are watching at home, but also providing great help, advice, and watching out for our co-workers here in the town. And before we start, I just want to say thank you to all the town employees that are out there working hard, from sanitation to buildings to every department, general services. You all are doing a tremendous job. And we're staying together, we're a family, and you know what, we're all going to be together in the end. So let us start with Doc. Maybe you could give us a little update on what's transpiring and a little advice for those viewers at home.
Sure, Supervisor. Good evening, everybody. So the most important thing, just to reiterate what the Supervisor's been saying and the Councilman, is we all need to do our part. This is, you know, I've been in emergency services for many years, the Councilman as well, and our colleagues. We need our civilian first responders. Every one of you out there watching today and watching this video tonight, it is time for you to take your parts in the cause to get this coronavirus under control, to get that curve flattened, as the Supervisor was mentioning. So these are the things we need you to do. It's scary, I understand. This is something we've never experienced in our lifetimes, but we know what we can do to stop the spread of this virus. We know what we can do to help and to keep ourselves safe, keep our families safe, keep our friends safe, and socially we need to, this is a social fabric, keep all of our friends and families and neighbors and citizens safe. So do social distancing. This is not a joke. It's not something that was made up. To some people it does seem like a skit from a comedy show. It is for real. This virus is spread by direct contact. That means that you're shaking your hands with somebody, you're touching them, you're hugging or kissing them, eating next to them, or being within a 6-foot radius for a period of time. If you don't follow the recommendations to avoid direct contact, you do have a possibility of spreading this virus. And we're seeing now more and more that people are coming to the hospital very sick. And the hospitals are keeping up right now, but we need to help them by not getting them overrun with any more patients than the sick ones they're already taking care of. So you guys have to stay home. Stay home if you're sick. There is no reason that you can't, for a week or 2 of your life, stay in your homes. Don't go out unless for emergencies, and stop the spread. It's direct contact. If you're not next to other people, the virus has nowhere to go, and then we start to get control of the situation that's rapidly expanding. Follow the directions for social distancing. If you don't contact people, then you're not going to be in trouble. You're not going to be spreading the virus. And finally, as the Supervisor and the Councilman mentioned, we need to take personal responsibility, washing hands. I carry Purell with me at all times. You know, if you don't have access to hand sanitizer, then soap and water. Make sure that you're constantly washing your hands. You've got to always have them clean, and consider that your face is the danger zone. This is how the virus enters. It has to go through your eyes or through your nose or through your mouth. So if you don't touch those parts of your face consciously every day, think about not touching that. Even if there's someone sick around you, you clean your hands, you don't touch your face, that's your protection. That's your body armor. That allows you to not get sick because you're not introducing the virus into your body. So we all have to take these steps to slow the spread of the virus. This is a crucial moment where it's either we're going to get control of this or it could go on for a long time. And so as a group, we're going to take care of each other. We're going to do the things that we need to do to stop the spread of this. We're going to take responsibility, stay home if we're sick, and then we're going to talk to you guys a little bit more, try to get some additional tips. I don't know if you guys want to add anything else before we start.
I do want the residents to know, right now, your essential services are still being complied with. The water's being provided, the garbage is being picked up with. Yes, we have limited access here in Town Hall. We still have created a network of telephone numbers and email addresses that you can visit on our social media pages to get inquiries at the building department, the clerk's office, the receiver's office. But again, following the doctor's advice, following the mandates of New York State, to help stop the spread of this, we've taken precautions. And it's both for the residents at home as well as for our coworkers here. We're here to provide the answers. One of the questions we see, Doctor, a lot of people are saying, what's a temperature that you should be a little more concerned that if you see it on your thermometer or on your head scanner?
Okay, so self-monitoring, we should all be doing that as well, and that's what the supervisor is asking in this question. So basically, with a thermometer, you should be checking your temperature at least once a day, better twice a day. And we're finding that some people are getting what would be considered a low-grade fever. So, realistically, anything higher than 99.5, you should keep an eye out. Anything more than 100.4, that's definitely a fever. If you do develop a fever, do not panic. First things first, don't go outside, stay your social distancing, don't have direct contact with other people. Then the next step you should do is call your doctor, call there are plenty of options of virtual urgent cares now. You want to not just immediately go to a hospital or to an urgent care or to a doctor's office if you have mild symptoms. It is very safe if you have mild symptoms and you check your temperature and you have a low-grade fever to take care of yourself at home. We have to save the hospitals and save the doctor's offices for the sicker patients, people that are just feeling symptoms like symptoms that you may feel from this in addition to the fever. You may have a cough, you may have a runny nose and congestion in your sinuses, you may develop nausea, vomiting, you may develop diarrhea. Interestingly, a lot of people are complaining that they're losing their sense of taste and smell, and you may have abdominal pain or pain in your back called flank pain. All of these could be symptoms of coronavirus. If you get those symptoms and you're not having serious symptoms, stay at home, do not panic, call your doctor, find an urgent care, there's lots of options, virtual urgent care, and then treat yourself at home. It's really important that we do this as a group, that we don't take up the spaces in the hospitals with complaints that aren't emergent. Make sure you're going with serious problems, so that way, and there's lots of resources that have been put together now for everybody that you can get access to telehealth and these things. So use those resources. That's the best way to take care of things if you start to develop a fever and you're not sure what to do.
Great.
Well, I think this is a question, I know that was something that we addressed, the supervisor and I and my colleagues on the town board were in support of, and we appeared with our receiver of taxes, Janine Driscoll, earlier this week. But Supervisor, I'm sure you could answer this best after your decades in the receiver of taxes office. Henry is asking if the second half school taxes due date is being extended.
The councilman, the receiver, as well as the town board asked the governor to extend the time period to pay taxes, your second half school taxes. It's due generally May 10th. This year it's the 11th because it's a weekend. We've asked the governor to extend it. We haven't gotten a response yet. We are very, very hopeful, and we're staying on top of it. Following up, I spoke to the governor's law representative today, and he says they're waiting for an answer from the governor. We're hopeful, because right now, the last thing people should have to worry about is paying their property taxes. Right now, people should be following the doctor's advice, staying indoors, maintaining that distance. 55,000 people a year come to the tax office. We don't want that. So Henry and all the other people out there, as soon as we get information, if that payment is going to be delayed, we will get it out there. And we're very hopeful the governor will do the right thing and extend that tax payment.
Okay, and another question someone's asking is, with when we're providing the advice to stay home, try to do telemedicine, or go to the hospital if you're really feeling the symptoms. One of the questions was, why do people at home keep seeing the numbers on the news? And I think it's important to point out that the town of Hempstead doesn't provide those numbers. Those come from, I guess, if you want to comment. Yeah, it's the county health department. But I guess if you can explain a little as to why they're sharing the numbers and why we're encouraging people that unless you are really symptomatic and having trouble breathing, that we're trying to keep the hospitals.
Sure. So we are in constant communication with the health department. As the town's physician, I basically am talking to the director and the commissioner over there on a near daily basis, if not a few times daily. This is important because this has to be a coordinated response, starting with you as our civilian responders, going up through all of our first responders, police, fire, and EMS, and all our doctors and nurses and medical providers, and obviously the leadership in the town to make sure that we're providing everyone with the essential services. So the question as to when should you call for help, and the best answer to that is the symptoms that I would say are concerning, that you really need to go to a hospital or see a doctor, any increasing shortness of breath. And sometimes the people that get sick, they get sick rapidly if they're going to get sick, and they develop shortness of breath. If you feel like you're having trouble breathing, not a discomfort, not a cough, but actually the air is not going in and out, or you feel like you cannot get a deep breath, do not hesitate. That is an absolute reason that you need to seek medical attention immediately. Also, with some people getting nausea and vomiting and diarrhea, they can get dehydration from that. So if you're unable to keep down fluids, or you're having a lot of vomiting and you feel that you're getting dehydrated and weak, that also is extremely important that you seek out medical attention. So most people that get this, it's just like a bad flu, they have their body aches, their sense of smell goes away, they have a fever, but otherwise they are okay. They take Tylenol, and that's important also. There's some literature saying that anti-inflammatories like ibuprofen may make this worse. So stick with Tylenol. That's your best bet. The people that get really sick from the anti-inflammatories seem to be more the hospitalized ones, but there's no reason that we shouldn't follow those recommendations for you at home. And then, Councilman, what was the second part of the question?
I guess why the county is sharing the numbers that they are.
So it's important that the county is sharing those numbers because you, as the public, need to understand that this is real. Those numbers are doubling every 2 to 3 days. The curve that the supervisor was mentioning earlier, that's how we're tracking. One of our biologists here in the town is actually helping us as the EMS staff, providing us with the intelligence so that we are following that. The health department in this county released those numbers, so we're able to tailor our response. From your end, that should just indicate to you that this is serious, that we must do the things that we're talking about. Don't get overly concerned about the numbers. That's more for us to take care of as medical professionals. But it just gives us an idea of if our interventions are working, and gives us an idea of what resources we have to bring to make sure that we can take care of everything for you guys. So just watch the news, listen to our recommendations, stay at home. Any symptoms that seem to be really serious, that's when you go go to the hospital. And if you have serious symptoms, do not hesitate to ask for help. Just stay at home if you don't have serious symptoms.
A lot of people want to know if they want to get tested, how would they go about it?
So as we mentioned earlier, the last time we were here, and I believe it's up on the...
And Doc, I'm sorry to interrupt, but just to follow up on the supervisor's questions, I think it's sort of a two-part because I see them coming in now. Not only how should they get tested, but when they should decide to get tested.
Okay.
Should everyone get tested, or should we be saving the test for those who are in real bad shape?
So first off, that they are still a shortage of tests now, not because we're not receiving them, but because more and more people are going to get tested. So that still is a little bit in flux. The Jones Beach test site, which I believe we have up on our website, that phone number. So if you go to our website, that phone number is on there. That is still the best avenue to get tested. You can also reach out to your primary care doc. Hospitals do have the tests, but they are saving them for the most sick to make sure that we are treating people appropriately when they come into the hospital. And urgent cares also have those tests. the tests are extremely important for us as medical professionals to make sure that we are treating the proper people and that we are quarantining or asking people to self-quarantine, to stay at home for the contacts of people that have coronavirus. Even though we have community spread right now, we still want to slow the spread. That's why we're doing all the stuff that we're talking about. So if you have symptoms of a viral syndrome and it seems like it's coronavirus and you're at home and you are quarantining yourself at home and you've let your direct contacts know that they should keep an eye out and they should stay home, the test is not going to change your outcome. What we need to do is save those tests for the very sick and for those that are in the hospital so we can use them. Or as physicians, sometimes if we're unsure, because the symptoms of coronavirus can sometimes be multitude of different symptoms, we'll use that to help direct care. But as the public, you do not need the test in order to get yourself better. So save those tests for us as healthcare professionals. Let us decide who needs to get those tests the most. Eventually, hopefully, we'll have access, like they did in South Korea, to lots of tests. They are actually able to get those as an over-the-counter test at a pharmacy in South Korea. They tested a large number of their population. Over 250,000 people got tested. We are not to that capability yet. At the point we are, then it would make sense that everyone get tested, because then it would be a lot easier to keep the people home that have it. But until then, keep the tests for the healthcare providers, keep the tests for our first responders, keep the tests for the truly sick, and make sure that, again, from the social justice perspective, that we're working together as a team and we're not using tests that we need to really get the sick people better.
Okay. I think one of the questions that's popped up is, and I guess it's focused more on our employees, but not really, because it involves anyone who visits town hall. And I don't think there's really an answer for it, because as we've talked about in the past week or so, this is really unraveling each and every day. But people are asking, when do you think things will get back to normal? When do you think town hall will be open again? When do you think kids will be able to go out onto those baseball fields? And I don't think we really have an answer right now.
I mean, Kevin, the answer to people asking those questions is minimum a few weeks. We're hopeful, if people do the social distancing, if we take the steps we're taking to slow the spread, that after a few weeks they may be able to release some of the more restrictive rules and regulations that we're following now, with businesses being closed and restaurants being closed. And obviously, as medical professionals, I hear this every day, that it's an effect on the economy, and we understand. But if we don't stop this now, and this persists for not weeks, but months, that will be a much greater hit on our economy. So sometimes, like you have, this isn't cancer, but as sometimes in cancer, you have to give chemotherapy to take care of the problem, and then that gives the body a chance to fight it off on its own. So it's something similar here. We need to take steps that are inconveniencing ourselves now, because if we do that, it'll shorten the length, it'll make less people sick, it'll allow our hospitals to function properly, it'll allow emergency services not to get overloaded, and then, in a few weeks, once we're getting better, then they can make those decisions. But if we don't take those steps now and it continues to get worse, it could be a lot longer than that. So we're very hopeful that people listen to this message. Please do what we're asking of you. It's very, very important. More important probably that you can do right now than anything we've ever asked the civilians in our town to do. The town of Hempstead and our neighboring towns, if they're watching, we can make a difference if you guys follow these rules. This is the time to act. This is the time to be our civilian first responders. This is time to look out for others, make sure we have each other's backs. It's really important.
Doc, one thing I've tried to stress to everybody we work with in the town: if you do not feel well, don't come in. Don't come in. And I can't stress that enough to people. And it's just something I hope you can reinforce to everybody out there that either works in the town, works in another job, about the importance that if you're not feeling well, not going out and just remaining home and taking that extra step, because it really in the end can make such a big difference.
Yeah, no, absolutely, Supervisor. No one should be going to work sick. I know we have this work ethic in America, and I can tell you that, as a doctor, even we're not immune to the fact that sometimes you have to go to work and you feel a little under the weather, and you want to power through and prove that that you're strong. But this is not the time to be doing this. Have an extremely low threshold. If you're having any symptoms, then stay home. Take a day or two. You feel better, great. You take a day or two and you develop a fever, awesome, but no one wants to be the one to spread this to somebody else, especially if that person you spread it to ends up having a life-threatening complication or dying, and you realize that you contributed to the spread of that. That is not something anyone should have to have on their conscience. It's literally that serious. So if we all do this together and do what we're supposed to be doing, we'll watch each other's backs, and we won't have to have these conversations much longer. But it's just, don't go to work sick. Do not touch your face. Wash your hands. Social distancing. Don't treat this like a vacation. I can't reiterate this enough right now, how important this is.
And Doc, I think, anybody who's, I guess, been involved in emergency management, we all know that everybody handles stress very differently. And I think one of the questions that's popped up, and I think it's a great question, this is a stressful time, not only
Absolutely.
for the people on the front lines, but those who are home, because they're nervous, they're scared, they have people in their lives, loved ones who could be vulnerable. So some tips that you may have to maintain good mental health while staying home, doing social distancing. Is it okay to get out there and keep your distance and take a nice walk around the block? Is it okay to jump on your bike? I think these are all questions, and there's sort of mixed messages that people are getting.
Yeah. So, and Councilman, I mean, just to what you're saying, this is a stressful time for all of us. This is an unprecedented situation that no one in our lifetimes have seen. The last time we had any kind of pandemic similar to this was the flu pandemic in 1918. So we're talking 100 years ago. So only the people that are centenarians right now would understand what Spanish flu was in 1918. And that was and thankfully that 1918 pandemic killed millions of people. We're not going to see that from this, but we don't want anyone to die or have a bad complication. So if you have a chance, read about the Spanish flu. Understand that while this is not as deadly, it is still very deadly to those that get sick. But this should not stop us from living our lives. We have to maintain our social fabric. We have to maintain some sense of normalcy. Before I came over here tonight, I was vacuuming my house and petting my cats because, I have spent, and all of us have been multiple hours a day working on this. I'm working this evening. That's why you see me in my scrubs. And so, but we have to take personal time. You reach out, between social media and the phone. I can't tell you, I have been talking to people I knew 25 years ago, reaching out, making sure that I'm okay, reaching out to our EMTs. So look out for each other. Take care of our first responders. Take care of our doctors and nurses and PAs and techs and all the people on the front lines. And it's okay to go outside as long as you're social distancing. We don't want 1 million people in a park. We want one person taking a walk. You want to go out and walk your dog around the block. As long as you're not directly in contact with people, being outside is not dangerous. But it's population density. If you're in densely populated areas, if you're in parties, if you're in rooms where you have multiple people, that's where it's easily spread. If you have fresh air around and you want to take a bike ride or you want to, you want to take a walk, as long as you're not around other people, then it's perfectly fine to do that. I mean, you need to do some things to keep your sanity. You need to make sure you acknowledge that this is a stressful situation, and don't lash out at people. A lot of times when you're stressed, you internalize it, and then you get upset and you get angry. It's okay to be stressed. We need to explain and talk to each other and be open that, hey, I'm stressed, but we're going to get through this together. Just like after Hurricane Sandy, when we took a huge hit, and it was the worst thing that we had seen probably before this, and we all took together. We all got together as a community and helped each other and to recover. It's going to be the same thing now. So just call the seniors that are home. Call your family members. We have lots of ways of keeping in touch with people, and then that's how you keep your mental health.
I think on a similar note, although that we're encouraging people to try to keep as normal of a life as possible, like you mentioned, we also need to follow the rules and protocol in place. I mean, if you're going to pack people into a park, if you're going to pack people onto a boardwalk, there's going to unfortunately be repercussions, and we're not going to be able to have those things anymore.
Right.
And I just want to point out, our partners in government in New York State have a COVID-19 emotional support hotline, and the number is 1-844-863-9314. So that's 1-844-863-9314.
We had a couple of questions about some of the town services. And again, we go back to the fact that in the interest of our coworkers as well as the residents, we're limiting access right here in the town hall. So what we've done is we've created an auto attendant hotline where you can dial 516-812-3600, and you'll be able to log into or leave a message with the clerk's office or the building department or the tax office or the parks department, and somebody will call you back, let it be any question or an application you're looking for. In addition to that, through the building department, we are having staff call up and walk people through the permits. We're trying to provide as much service as we can while also recognizing we don't want people coming here. We don't want people out. As the doctor said, we're trying to take every precaution, and it's really been a great two-way street. The residents have been incredibly understanding, and we're very, very fortunate. We work with some amazing people here in the town. And I know many of you are watching, and I know Terry's watching right now. This is an amazing workforce. And I want to thank all of you, and I cannot stress this again. I understand, you know, this is a tough time for all of us. And so many of you are coming in, you're essential, you're doing your jobs, and I recognize that stress. And the board and all of us can't thank you enough. And the residents can't as well, because it's really important what you're doing, and you need to recognize that, because we definitely do. On a side note, the doctor was also talking about, I took the time to go out to a store, and a lot of the stores have food again. A lot of them have groceries out there, and they're taking steps of limiting the number of people who go into a store. So I know, like last weekend in particular, that stress level you talked about, and I felt it, and we all felt it. You know what? You can take that ability now to go out and get some groceries, some fresh, vegetables, some fruit. But also it's nice to see the stores are recognizing that, and they're limiting the number of people out there. You know, we want people to get out, and the councilman touched base on it. We've limited some of our parks. We don't want you playing basketball. We don't want you playing tennis. We don't want the kids on the gym equipment. We want to give you the ability to get out there and maintain some sanity. Because I recognize it as well as you. I mean, the doctor here, as far as I'm concerned, you're tireless. You're working during the day with us. You're at night, you're at the hospital. And to think before you go to the hospital, you're here trying to provide some answers to the residents. And we're very, very grateful for that. But if you do have those questions, you can also go to the town website, and we've created individual links. You can email those departments with any questions, and we'll try and provide you with the timely answer to give you those services you may need. Councilman?
I really just want to say thank you as well. Not only, I know I said before, but I know I speak on behalf of my colleagues on the town board to say thank you to each and every member of CSEA 880 for the work that you're doing. Whether you're here or whether you're working from home, whatever the case may be, we appreciate it. And to everyone else, I mean, the town of Hempstead is the largest township in America. We are a diverse town. And whether it is the cops and the firemen and EMS, whether it's the medical professionals at the hospitals or the doctor's office, or it's the people, the grocers that are working in grocery stores, everyone is dealing with stress in different ways, and everyone has loved ones and family at home that they also need to worry about. And I just, we always say that in some of our darkest times, it really brings out some of the best in people. And I just, to all of you listening at home, to all of you who are away from their families for extended periods of time, to make sure that our neighbors are kept safe and healthy, it's appreciated more than anyone can imagine. And like the doctor said, like Supervisor Clavin said, if we stick together, if we follow the rules, there's some rough days ahead, no doubt. But, we have brighter days ahead, and we'll all get through this. And I really hope and pray that what we've gone through makes us all better people, makes us a healthier world, and a safer township.
Yeah, absolutely. And just really quick, guys, so you know, and the many roles that I've been playing with the town for this pandemic, the care and the medical care and the surveillance and the assistance to our CSA 880 workers and all of our town workers. It is my job to make sure the town workers are safe. It's my job to provide medical advice to these gentlemen in the board to make sure that you are getting the right advice. So we have medical professionals working here, looking out for our workforce, looking out for you. It has been a wonderful team. The support has been amazing from the government. You have to understand that we as a team have been ahead of this or on top of this the entire time, and we're going to continue doing that to make sure we get you the right information, to make sure that all our essential workers are safe, to make sure that people at home are safe, and to make sure that all of our, first responders and medical professionals and everyone just watching at home, we want you to be safe and healthy and get the right information so we can do this together. So it's a team, and it's been a good team, and we're going to continue fighting the good fight with this. So.
Absolutely.
Yeah.
Amen.
And again, I want to thank you, Doctor. I want to thank you, Anthony. I want to thank all of you watching. We're trying to do these on a regular basis, to keep you up to date, to give the advice. But I hope this finds all of you safe. But I can't stress to you enough. The doctor's given some solid advice here. The governor has given solid advice. If you don't need to go out, stay home. Social distance. Wash your hands. It's little things like this that are going to matter so much at the end. And we will be having another one of these meetings. We'll have it up on the website. I hope this was informative again. And ladies and gentlemen watching, email some questions. Just because this is over now does not mean we cannot try and follow up and answer those questions another time. And the next one, if we could schedule it during the day to make it a little bit easier. But I think I just want to speak on behalf of everybody saying, thank you. I hope everybody remains safe. Take the right precautions. God bless, and we'll see you soon.
Stay healthy, everybody.